Hello everyone, let's discuss multi-drug resistant tuberculosis guidelines 2022. The WHO suggests 6 months regime of bedaquiline, lanzolate, moxifloxacin and pretomanid rather than 9 months duration and 18 months in MDR and rifampicin resistance. After initiating this regime, we have to perform drug sensitivity test for fluoroquinolones so that we can make decision to stop or continue moxifloxacin for remaining period. If there is resistance to moxifloxacin, we will stop it and continue with other drugs, and we will label it pre-XDR. This regime is for people with resistance to rifampicin, MDR and pre-XDR, and it is also used for people with confirmed pulmonary tuberculosis and all forms of extrapulmonary tuberculosis except CNS tuberculosis, osteoarticular and miliary disseminated tuberculosis. It can be given in all HIV positive patients with MDR. This regime is not recommended for pregnant and breastfeeding women due to limited evidence of safety of pretomanid. Dosage of bedaquiline 400 mg once daily for first 2 weeks, then 200 mg 3 times per week. The lanzolate is 600 mg daily once daily for 24 weeks. Pretomanid 200 mg OD for 24 weeks. The 9-month oral regime for MDR and rifampicin resistance, WHO recommends 9 months regime rather than 18 months regime in patients with MDR and rifampicin resistant TB in whom resistance to fluoroquinolone has been excluded. 9 months regime can be given, and it is consistent of bedaquiline for 6 months in combination of levofloxacin or moxifloxacin, ethionamide, ethambutol, isoniazid in high dosage, pyrazamide and clofazimine for 4 months, and we can extend it up to 6 months if there is sputum positive at the end of 4 months, followed by treatment with levofloxacin, moxifloxacin, clofazimine, ethambutol and pyrazamide for 5 months. In pregnant women, 2 months of lanzolate can be used instead of ethionamide. Antiretroviral therapy is recommended for all HIV positive patients and drug resistant tuberculosis requiring second line anti-tuberculosis drugs irrespective of CD4 cell count as early as possible. Elective lobotomy or wedge resection may be used alongside recommended regime of MDR tuberculosis.